Hello, healthy moms. Please, if you're around, just leave a comment. Good evening. Hope you all are doing well. And hope your day has been beautiful. It's been a hectic day around here, but we thank God. How are you all doing? Please, if you're around, leave a comment, leave a like. Please do not forget to share the video so that some other mother can see this. Okay? Thank you so much for joining us again today for another session. It's a very emotional session for me because apart from the fact that we're talking about birth, postpartum complications, I actually lost a friend to a postpartum complication, one which we are going to be talking about today. I was willing to talk about postpartum complications as a whole topic and just hit on the different complications and just talk a little about it and throw a little bit of light on it. But I felt like there are some which are very delicate and needs for mothers to understand it better and understand it very clearly so as to help them to prevent it. So now, the reason why we talk about these topics is not to scare you. So do not be scared listening to these things, because I believe that the more we know, the less we fear. And if you fear less, then you have more of the ability to fight, right? If you have less fear, you'll be more confident to fight a certain issue or know how to go around a certain issue. So today we are going to be talking about postpartum complications. And the fact that maybe you've given birth normally and everything came out fine once or twice doesn't mean that you can't get a complication. Yes, everyone can get a complication. The more births you have, even, the higher the possibility of you having a postpartum complication. So today, we are going to be talking about the first topic on postpartum complications, and the first one is going to be postpartum hemorrhage. I'm going to go on to talk, but I want to say hi to the people watching me. So if you're around, please say hello and send a like and share the video, because there might be a mother who is just looking for this information. So please try to share, leave a comment. Please, if you're watching me from my personal Facebook account, I can't see your comments. If you're watching from YouTube, I can't see your comments as well. But if you're watching from my Nyango Facebook page, then I'll be able to see your comments. So if you're leaving comments there, I'm sorry I'm not seeing them. That's why I can't reply to you if you're leaving comments there. So we are going to go on to talk about postpartum hemorrhage. Now, there are some simple facts which I want you to know about this topic. It is not something which is very, very common, but usually when it happens, it is one of the main causes of death, of postpartum death in women. Like one of the main causes or the main reasons why women die after giving birth. And also it happens in 1 to 5 women in 100 women. So as I said, it's not very common, but it is one of the things which causes a lot of deaths with women after they've given birth. Also, it is one of the top reasons for postpartum mortality, as I said before. Also, it can happen immediately after birth or as far as 12 to 16 weeks after birth. Now, why do we need to know about postpartum hemorrhage? The thing is, right after the period you give birth, everyone is excited about the baby and everyone is so concerned about the baby. If you have given birth before, you would know that after giving birth, the first visit you're going back to the hospital is for the baby. It's not for you. You go to the hospital for the baby to be checked. They check the baby and they might just ask you some few questions, but that particular visit is not for you. Like after that, every visit you go, they are concentrating so much on the baby, maybe giving the baby vaccines and just doing stuff for the baby. And no one is really caring so much about the mother, which is the reason why us mothers have to be aware of these things, so that if you're feeling something, you know when it is in the level of, okay, this is normal, and when it is not. I remember a mother reached out to me one time and she was like, she's feeling a lot of pains like under her tummy after she has given birth. That didn't happen to her when it was her first child. That she does not know if this is normal because the pain is really, really severe. So I had to go study about it, ask some questions, and then come back to her and tell her, normally when you give birth, your uterus, which is your womb, is contracting, it's getting smaller. So as it is contracting, most times it will cause pain, especially after you've breastfed your baby. So she understood and she was a little bit more comfortable. But the problem is, most times our doctors don't explain to us these things. So you go into it and you're so ignorant, and then you don't know what is normal and what is abnormal. So us mothers have to learn about these things so that we are more aware. And if there is a problem, we can seek for help fast enough so that they help us. And in an economy like ours, in the less developed countries, which maybe you go to the hospital and they will not attend to you immediately, they would just slow things so much that if it's actually a real emergency, you might die before the doctor gets to you. So we have to be very, very alert to know these things so that we can try to seek for help, to seek for timely help before things get out of hand. So those are some facts about postpartum hemorrhage that I wanted you to know about. So right now I'm going to go on to tell you what postpartum hemorrhage means, right? So usually a good definition is it is a significant amount of blood loss in the mother, which leads to symptoms like dizziness, pale skin, having chills, nausea, increased swelling, pain in the perineum, which is the area in between the V and the anus, right? I don't want Facebook banning me, so I can't call some names because I don't know if they are I don't know how to say this, if you're not supposed to say them. So the perineum is the area between the V and the anus. So if you are having severe pain in that area, that's also one of the symptoms which you should reach out to your doctor. If you're having so much fatigue, that's also a symptom which, if it comes with a lot of bleeding, you should reach out to your doctor. If you're having if you're soaking a very thick pad, because normally after you give birth, bleeding is normal, but if you're soaking that birth pad in about an hour or 2 hours, then you should reach out to your doctor. If you have clots, really large clots also, you should reach out to your doctor. So a simple definition for postpartum hemorrhage will be significant blood loss which leads to symptoms, the symptoms which I've outlined. Now, there are other definitions like when a woman is bleeding, when a woman has greater than 500 mils of blood after a vaginal birth, or 1,000 mils of blood, greater than 1,000 mils of blood after a CS. But this definition is not a good one because most times when you're bleeding, like you're on your period, you won't know the amount of blood you're bleeding, right? There is no one who will come and measure the blood for you. So this is not a very good definition, though, yes, those are the standard definitions that they'll give out there. There's another one which says any bleeding which leads to greater than 10% fall in your hemoglobin level. Your hemoglobin level is what they test when you go to the lab to know what level your blood is. But also this definition is not a good one because there are times that you go to the lab and they'll test your blood, that you've lost blood, but they'll not see it immediately. Like blood loss takes time for it to show with this lab test. So that is not also a good definition. What I consider as a good definition is any significant blood loss that leads to all the symptoms that I outlined earlier. And also, postpartum hemorrhage is classified into two. So there is primary, which is heavy bleeding within the first 24 hours after birth. And then there is secondary or late hemorrhage, which is bleeding after 24 hours of birth. Now, let's go on to talk about the causes. From the causes, I'm going to talk about risk factors, and then I'm going to talk about how you can prevent them. And then lastly, I'm going to talk about some remedies that you might get if you actually have it, and maybe you're in the hospital, what the healthcare professionals will do to help you. I really don't want to arouse any fear in someone, but I really want you to know that these things are possible and they happen. So know about it so that if it happens to you or anyone close to you, you know what to do. and you just understand it better, and it would help you not to panic so much if it happens to someone around you. There are women who have gone through postpartum hemorrhage and they didn't die. So you having timely care will really help so much in just removing the risk of death and other things. I'm sorry about my lighting. Let me get it back. Okay. Okay, I'm going to go back to our talk pretty soon. My lighting just had an issue, so I'm trying to rectify it. Oh my, this is crazy. Okay, we will have to deal with this for a while. I'm going to go on to talk about the causes in about a minute. I'm just trying to rectify my lighting a bit. It just went off. I don't know why. This one is not that good. I'm trying with my phone. I'm sorry about the delay, but we'll soon go on to talk about the causes. Let me just work on my lighting a little. Okay, I hope this lasts. Ow. Okay, now let's go on to talk about the causes. When talking about postpartum hemorrhage, there are four main causes which are classified as the 4Ts. Normally, I don't want to make this too medical, but I really want us to understand it and understand it well. So when they talk about the 4Ts involve tone, trauma, tissue, and probing. I'm going to tell you all what this is, but I want it in a way that if you get a medical person talking about this, you understand that you can ask some very reasonable questions so you understand what is going on. Now, when they talk about tone, it actually refers to like uterine contractions, when your womb feels to have uterine contractions. Let me explain this. Now, when a woman gives birth, right, the placenta is usually attached to your womb, because that's where all food and everything that the baby needs passes before it gets to the baby. So it's attached to the womb like this. Now, when I'm doing with my hands, it is not physically attached, but it's not yes, physically attached, because I just put my hands together. But in the womb, it's actually attached in a way that when the placenta comes out, there are blood vessels which are open there, right? And if your uterus does not contract well enough, those blood vessels will be open. And that is what will lead to you bleeding so much, to the extent that you have all the symptoms that I talked about. So it is very, very important. Though, yes, contractions after birth might be painful, it is very, very important that your uterus contracts. That is, your womb reduces and goes back to the normal shape, because it helps also close these blood muscles which have been left open when the placenta comes out. I hope that is understandable. Now, this is usually called uterine atony or acne. That's how they call it in the medical field. And it could have a lot of causes, right? Some of the causes might involve multiple pregnancies, multiple birth, if you're maybe carrying more than one baby, multiple pregnancies, if you've given birth more than once. Normally, it makes your uterus to have opened and it's coming back so many times. For example, if you have, say, for example, it's not a very good example, but if you have a dress with maybe an elastic, and you keep opening and closing the elastic, normally the elastic gets a little weak. That is like an illustration of what happens. That is why multiple pregnancies can actually cause uterine acne. So it's usually said that this particular condition, when a woman's uterus does not contract very well, leading to the blood vessels not closing, is one of the main causes of postpartum hemorrhage. It is one of the main causes of heavy bleeding after birth. So as I said before, the causes of this particular condition, which causes postpartum hemorrhage, are multiple pregnancies, multiple birth, prolonged labor, that is stress due to labor, because when you're in labor, your uterus is contracting and getting back together is really, really working your womb. So prolonged labor can also lead to postpartum hemorrhage. Anything that is used to relax your muscles, because if your muscles are made to relax, then you might not have as much contractions as you're supposed to have. Then your blood vessels, which were open because your placenta has left, might not be able to close up, and then you might continue bleeding. Also, another thing which might cause uterine acne, which is the main cause of postpartum hemorrhage, is you not being able to urinate. This is the reason why when women are to go for CS, they are usually put a catheter so that the urine comes out of the bladder on its own without you struggling to pee, since maybe in that case and you have been given anesthesia and maybe you cannot control how you pee. Because when you cannot pee, your bladder enlarges and it just makes it difficult for your uterus to contract and go back to the way it was. Another thing which can cause uterine acne is medications. There are some medications that they might give you maybe before birth or after birth that might cause this for some people. For some people, it's not like that. Now, some things that they do in the hospital to remedy this particular case is uterine massage. I've heard about this, like when people give birth in Equatorial Guinea, the women usually complain that they massage their tummies so much. So this really helps prevent postpartum hemorrhage. So uterine massage is not very comfortable because after your womb has struggled so much to remove the baby, and then you can imagine the muscles are already strained and then somebody's massaging it. So it's not really a very comfortable thing, but it helps so much to ease or help the uterus, which is the womb, to contract very well. Now, let's go on to the next cause of postpartum hemorrhage. We're on the first T, which is tone, which is actually failure of the uterus contracting. Okay, now we go to the next cause, which is trauma. Any trauma on your uterus, which is your womb, might make it in such a way that you might bleed so much after birth. Some of the possible traumas are CS. Just the fact that the baby is coming out of your cervix might strain your womb. Also, medical instruments used during birth can also lead to trauma of your uterus, because these particular traumas involve any trauma on the genital structure, which might involve your uterus, that is your womb, your cervix, which is the road in which the baby passes, your V or your perineum, that particular place which I said is in between your V and your anus. So any trauma on those particular places might lead to heavy bleeding after birth. Now, the remedy for this one are usually surgical. The remedies for postpartum hemorrhage will really depend on the particular cause. So there are 4 main causes, and the remedy that they give you or they give someone who has postpartum hemorrhage will depend on the particular cause. So if your postpartum hemorrhage is caused by trauma of your uterus, your cervix, your vagina, or your perineum, then there are surgical things that can be done by the doctors to remedy that particular situation. Now, another cause is tissue. When they talk about tissue, they refer to retention of the placenta, either part or full. So if any tissue remains in your tummy, which is not supposed to remain there normally, because when you give birth, your placenta is supposed to come out, it can lead to postpartum hemorrhage. And in such a case, the remedy is to make sure that the placenta comes out totally, or they try to remove any little part of the placenta that remained in your tummy. Now, the last one is what they call thrombin. Thrombin is actually when you have blood clotting conditions. This is not the case of when we think that blood clotting is a bad thing, but when your uterus is contracting, it leads to a certain situation whereby the tissues which are open have to clot in a certain way so that blood does not keep coming out. Because if they don't clot, then blood will keep coming out, right? But if this particular condition, which is thrombin, happens to you and they don't clot, that can also lead to you bleeding more than you're supposed to. So there we go with the causes. I'm going to go on now to talk about risk factors. I'm not going to explain so deeply into this one because I'm sure we've understood the causes and we know the things that can be done. So you can either be having issues, you can either have postpartum hemorrhage because your uterine is not contracting very well, or because there is some trauma on your genital structure, or there is retained placenta tissues, or there is coagulation problems. Now, let's go on to risk factors. What can actually put you at risk of having postpartum hemorrhage? The first thing is your uterus not contracting. As I said before, uterine atony is one of the main causes of postpartum hemorrhage, which is heavy bleeding which is heavy bleeding after giving birth. Now, the second reason is low blood. Like if your blood was normally low before delivery, any little loss of blood might lead to complications. For example, if I have a bottle full of water like this one, if I pour half of it, it's just half. Now, if I have half a bottle of water and I pour half of it, my bottle is already empty. That's what I'm trying to explain. So if your blood was normally low, say you had half, if you lose even half of that, it might not be like somebody who had up to this level and then loses half, right? So we have to try for our blood level to be the average, which is above 12 before we are giving birth. Now, another thing which might lead to postpartum, which might put you at risk of postpartum hemorrhage is pre-eclampsia. If you've not watched our pre-eclampsia video, please go ahead, check our videos, and you're going to see a video on pre-eclampsia. If you want to know about it, watch that video and also go and do some research and read about pre-eclampsia. Also, severe hemorrhage in the past. If you've had hemorrhage in the past, it might also lead to you having hemorrhage after giving birth. Another thing is attempting vaginal birth after a CS. This is one of the main reasons why doctors don't let women who have had CS to have vaginal birth, because there are so many complications that can come out of it, right? So they prefer to go the safest way for you and your baby. That is why most times they'll refer that for women who have had a C-section before, they should just continue with their C-section. Now, multiple births. Multiple births really causes a strain on, a strain on not only your genital structure, it just causes a strain on your whole system there, because your stomach, your womb will normally enlarge times maybe 2 or 3, depending on the number of children that you're carrying. And also to push those babies out, it will take more effort than a mother who is giving birth to one. Also, another thing which might put you at risk of postpartum hemorrhage is induced labor. Induced labor forces your uterus to contract and make the baby to come out by force, and it might put a lot of pressure on your genital structure, so it is not very good and it puts you at risk. But now, if in a case that the baby staying inside you is more harmful than them inducing the baby, they'll go for inducing the baby because they're looking for the solution which is safer for you and the baby. There might be risk to inducing you into labor, but if they realize that the risk of inducing you is not as high as letting the baby stay in you for longer, then it is good for them to induce you. So those are risk factors which might put you at a very high risk of postpartum hemorrhage. Now, we are going to go on to talk about some ways to prevent postpartum hemorrhage. Yes, some things are better prevented than letting them happen, because in a medical situation, like I talked about earlier, we don't have that kind of medical structure which immediately you fall sick, there might be a doctor to just come to you like that. So some of these things, it's better when we prevent them than when we let them happen to us. So what things can you do to prevent postpartum hemorrhage? Avoiding being induced except when medically necessary. Some women just feel that, okay, I'm 39 weeks, I'm 40 weeks, baby has not come, I'm going to the hospital, I'm telling them to induce me. There are risks that are attached to these things. A doctor will only advise for you to be induced when he realizes that the risk of the baby staying inside you is higher than the risk of you being induced, okay? So if it is not medically advised, don't go and tell your doctor to induce you and force them to induce you when they are saying it's not right for you, because you being induced might actually lead to postpartum hemorrhage. Another thing which you can avoid, which you can do to prevent postpartum hemorrhage, is trying to avoid tearing. trying to avoid tearing. Do whatever you can do so that you can give birth normally without having a tear, because having a tear might just lead to postpartum hemorrhage. Another thing which you can do is to learn how to push. Unfortunately, our midwives and our doctors around here don't teach us how to push, but there are lots and lots of videos online that you can actually learn how to push, learn breathing techniques when you're pushing. So if you're pregnant, please go on to such videos, search how to push, either on Google, on YouTube, anywhere, and you're going to see videos that are actually going to help you. So learn how to push so that when it's time to push, you don't put so much pressure and you don't waste so much energy and strain your uterus so much. And it's also going to help you to avoid tearing if you know how to push the right way. Also, what you can do is to consume enough ions during pregnancy, right? Either from foods or from your iron supplements, so that your blood is at the right level before you're going to give birth, right? So that you don't get to a level where you lose a little blood and then it's a problem. If your blood is normally high, losing a little blood might not be anything big, because normally after giving birth, you will lose some blood. You're going to bleed a little. Okay, now let's go on to other things which you can do to prevent postpartum hemorrhage. You can avoid epidural. Avoid the use of epidural if you can, except if medically necessary. A lot of women these days, they're looking for the easy way to do things, but sometimes the easy way is not the best way, because epidural relaxes your muscles, and since you're not feeling the pain anymore, you might have to push too much than if you were actually feeling, or your body and your hormones are allowing you to push naturally. Okay, what you can also do to prevent postpartum hemorrhage is nurse your baby immediately after birth if you can, because your baby latching on your breast encourages contractions, which will help for those tissues, those blood tissues which have been left open, to contract and then close up so that you don't bleed so much. Now, those are things which you can do to prevent postpartum hemorrhage. Now, what of a case where you have postpartum hemorrhage, and what will the doctors do to help you? If maybe you have postpartum hemorrhage immediately after delivering your baby and your placenta is not yet out, they are going to struggle to pull out the placenta while pressing your stomach so that it comes out, everything comes out, and you can go on to live your normal life after that. But in case that they realize that that is not happening and it's getting more serious, they might put gauze on your V to just help to cup the blood off, or the blood to have somewhere to go to try to stop it. Or also, as I said before, in the case of uterine acne, they can massage your uterus, they can massage your stomach from outside, trying to help your uterus to contract so that the bleeding stops. But in either case, if they realize that you have postpartum hemorrhage, it's always an emergency, so they are going to do everything to care for you. Now, another thing which they might do is to give you a blood transfusion, because if blood is going out of your body, the easiest way they can do to help you is replenish that blood so that there is no shortage and it doesn't lead to some symptoms that you might have, maybe hemorrhage shock, and then you can die. So they would probably give you a blood transfusion, and they'll give you some other medications. Also, what you can do if you've gone home after a postpartum hemorrhage is drink a lot of bone broth. So you can buy beef from the market which has a lot of bones, and they just make it for you like pepper soup, right? And let's drink a lot of that water, because it has a lot of protein and ions, which can help you to restore what you've lost while you had the hemorrhage. Also, get a lot of rest, because you need it. After losing that much blood, you need to rest to regain yourself. Also, you need to stay very hydrated, take iron supplements, eat foods which are rich in irons to help you replenish yourself after a postpartum hemorrhage. I hope this information was very, very helpful to you. Also, the last thing you can do is take vitamin C, probably vitamin C supplements, or you can take vitamin C fruits like oranges and all the other ones, carrots and all the other ones which you can find. But if you've had a hemorrhage, you have to be very careful with yourself. You have to take care of yourself so that it doesn't reoccur, or it doesn't just get to a situation which it doesn't need to get. So I hope this video was of help to you, and I really hope that you learned something, and with this you can help another woman if you realize that they are having certain issues. And I just hope that as we learn, we are going to fear less and be able and be confident to face these things if they happen to someone around us or they happen to us, right? We don't pray that it happens to us, but we just have to enlighten ourselves and know what could happen, because a lot of women go into pregnancy and they just feel, okay, our mothers got pregnant and they gave birth and everything was normal, so I'm also going to get pregnant and give birth and everything will be normal. That's the thoughts that most of us have in our minds. It's a good thought to have, but it is good also that we enlighten ourselves, seek for knowledge so that we know more and we know how to tackle these things if they happen to us. Next week, we are going to be talking about one other postpartum complication, and I hope you're going to be here to learn with us so that we can prevent these things, because no mother should lose a life while trying to give a life. At this point, I'm going to give a minute of silence for all the mothers who lost their life while trying to give life. And we pray that may their souls rest in peace. So our 1 minute is going to start in a few seconds, in about 10 seconds. And I really hope you learned something from today. We are going to start our minute of silence now. To all mothers who've lost their lives while trying to give life, may their soul rest in perfect peace. And I hope you could learn something today. Join me next week, Friday. Let's talk about other postpartum complications. And let's keep raising healthy, wealthy, and exemplary moms. For if we must raise healthy kids, us, the mothers, have to be healthy too. Thank you so much. If you have any questions, do not fail to drop them in the comment section. I'm going to try to go through them and leave answers or talk about them or give you answers in our next video. You have a beautiful day and may God bless you all. Again, I say thank you for watching and I hope you could learn something from this. A beautiful evening to you all. I'm going to leave you now. So bye-bye. Have a nice day.